Okay, so that's a great question because if you're bald, there's nothing there. There's no grass there. No matter how much we fertilize it, it ain't going to grow.
Right.
So that's a way to kind of think of these treatments is fertilizing the grass. You are giving those follicles everything they need to grow. If they're dead, they're not going to grow. Hey, everybody out there in internet lands.
Welcome to Skin Deep with Dr. Amy Miller.
And I'm Dr. Amy Miller. I'm coming at you today from St. Louis Skin Solutions in St. Louis, Missouri. And we are going to talk about hair.
Hair
loss,
to be specific.
Hair loss. Yeah.
But before we get started, my friend, we always talk about our wine. So the way that Jessie and I got Dr. Miller to do this lovely podcast is by telling her she could have wine every week. So today we have a lovely red blend called Ménage à Trois. It is 3 reds blended together, but we don't know which ones.
It's a secret.
It's a secret they won't tell us. It's lovely. It's tasty. It's nice and smooth. Great little light drinker.
It's very nice.
Very light. Okay, so without any more ado, let's talk hair loss.
Let's talk hair loss.
All right, first of all, what is hair loss?
Well,
for somebody who doesn't ever need to worry about
it.
That.
Well, a lot of women, especially postmenopausal women, experience hair loss. And it's just like it sounds. It's the hair follicles miniaturizing and dying, hair getting thinner, and hair loss, more scalp show. It can be related to a multitude of different things, but it's so important because as a female, that's our crown. That's what we present to the world. And it's all tied up in our sense of self and our sense of self-esteem. So when you losing your hair, it's
traumatic.
Yeah,
absolutely. So hair loss in women can be very psychologically damaging, right? Let's talk about it a little bit in men as well, though.
Yeah. So in men, it's been studied a lot more in men. And so women, they're just kind of thrown in along with men. Oh, if it works for men, it'll probably work for you gals. You try it. But men's hair loss is different than female hair loss. True androgenic alopecia there's a genetic component to it. There is a high conversion of testosterone to something called dihydrotestosterone, or DHT, in the hair follicle in certain men. And that DHT just kind of chokes off the follicle. So we used to say, well, balding men had so much testosterone. Well, no, that's not necessarily true. They just convert a lot of their testosterone in their scalp to dihydrotestosterone, DHT. In women, that can happen as well.
Okay.
But there's something called female pattern hair loss, which we don't really know the cause. We know there's a genetic component to it. If your mom, your grandmother had it, you may have it. There's something to do with the hormonal loss after menopause. You know, when you're pregnant, you got sky-high estrogen and progesterone. Your hair is luscious like a lion's mane.
Right.
And then when you give birth and those hormones plummet, you get this telogen. I can't say all your hair falls out.
Right.
And then you go to your OB and they pat you on the head and say, no, don't worry, it's going to come back. Well, and a lot of people does come back. But in some patients, only 80% comes back. In some patients, only 50% comes back of what they've lost.
Right.
So it's not something to just dismiss, which I'm afraid a lot of docs do that.
Sure. So what can you expect if you come to St. Louis Skin Solutions for a hair loss consultation?
Okay, so a couple things. We got to figure out, make sure that it's not nutritionally driven, that you're getting enough ferritin and you get enough iron and have enough ferritin in your bloodstream.
Okay.
And vitamin D. Those are 2 biggies that can result in hair loss. The other thing is thyroid disorders. If you're hypo or hyperthyroid, you can have hair issues. And you may not have full-blown hyper or hypothyroidism. It may be subclinical. So that needs to be tested. That's a whole nother podcast, another 10-hour discussion on thyroid and how undertreated it is.
Right.
Again,
normal, not optimal.
Exactly. So we check the thyroid status as well as your sex hormone status, your estrogen, progesterone, testosterone. We find that some women that are more leaning towards the androgenic side of things, they may not necessarily have a higher level of testosterone in their blood, but they may have more reactive receptors. That can be part of it as well. So we check all of that. And then we do something called the hair matrix. So when you are diagnosing hair loss, you need to look at the scalp, for goodness sake, because a lot of it starts at the scalp. There's microscopic inflammation at the scalp or macroscopic inflammation. You need to check the health of the scalp and the health of the hair.
So now we've done the blood work. We've done the hair matrix. We've got the assessment down. You're going to come back in another week or so to get the blood results. And we're going to build a treatment plan from there.
Right.
Just like all of our treatment plans, it's not a one-hit wonder. You're not one and done. This is going to be a whole thing that's going to help you to mitigate some of that hair loss and hopefully get you back on track.
Absolutely.
All right. So things we offer here at St. Louis Skin Solutions for hair loss.
So there are many things. So we'll talk little bit about all the options out there. The nutraceuticals.
Yep. Like the oral supplements.
Right, like the Viviscal and
Nutrafol.
Do they work? Do they not work? I don't know.
Yeah.
There's not great evidence behind it, not randomized controlled studies, yada, yada.
Right.
Is it going to hurt? No.
Right.
So
yeah.
If you want to try it, by all means, they're not cheap, but go for it.
Sure.
The other thing are those red light therapy, the LED lights.
Yeah.
And those actually do have some good evidence behind them. You have to use them regularly. You have to use them like the manufacturer says to use them. And it's going to take 6, 12, 18 months to really see full results.
Okay.
But it's a nice passive way of treating your hair loss. You stick the helmet on your head and you watch your favorite TV show. You do have to keep it up, though. So if you're going on vacation for 2 weeks, you need to take your helmet with you. Yes.
So other things, plated.
So plated.
What is plated?
Exosomes. Exosomes, a big buzzword lately. But there's something to it with hair loss. We've been seeing really good results. Exosomes, what are they? They are made by the cells in our body. They're little UPS packages that are full of lovely growth factors telling the follicle to start growing. So you apply that, you can put it topically. It's not FDA approved for injections. That might be changing.
Right.
Probably works best injection wise.
But you can microneedle. You can use it as your glide for microneedling, and then that will help get it in there to those hair follicles.
That's one way to get it in there a little deeper, and that's what we like to do here.
Yep. Absolutely.
So we're not technically injecting it. We're still applying it topically.
Correct.
The other thing that has been around a long time, but is now finally being acknowledged, and there's finally some studies on backing it, proving that it works, is platelet-rich plasma. We've been doing that here for 10, 15 years, and we were bucking the trend back then. People thought we were crazy.
What is platelet-rich plasma for those people that don't know? We talk about these things like everybody knows, and there are people in the world that don't know that.
I guess I need to explain that.
Yes.
Platelet-rich plasma, or PRP, is your own platelets from your own blood plasma. So we draw your blood and we spin it in a centrifuge and we siphon off the plasma. So the cells are out of there. Red blood cells are out of there. So that plasma is a pretty yellow color. And it's full of platelets. Platelets are what our body uses to heal things. So when we have a wound, platelets rush to the area. They release all their lovely growth factors to help seal the wound up, stop bleeding, clot things off. So when we take those and put them in the scalp by the hair follicles, it does a similar thing. It stimulates those follicles. What exactly does it do on a scientific nitty-gritty enzyme, protein, whatever level? We don't know.
Okay.
But we know those growth factors stimulate the hair follicles. Platelet-rich plasma is nice because it's your own stuff. You're not going to be allergic to it.
Right.
It is a blood draw, so you got to be okay with that, but it's not very much blood.
No.
Don't need a ton. And then we inject it into the scalp, or like we did with the exosomes, we can microneedle it.
Often we do a combination of both injections and microneedling for the scalp. It is a little spicy.
Yeah, it's a little spicy, but that's how you know it's working. It's a little stingy. That means when it's stingy, that means the platelets are releasing all their good stuff. If it's not stingy, I'm a little worried that you have defunct or poor platelets. Yes.
Yep. And the other one we have is the breeze.
Yes, and that's a great way to clean off the scalp, exfoliate the scalp, so all our lovely platelets and exosomes can penetrate better. It's a good deep cleaning.
It is a good deep cleaning, as before. When you're spinning that blood down, doing the breeze would be a really good thing to do while that blood was spinning down. What do you feel about other topicals? I know we talked platelet as a topical, topicals or shampoos or any of those kinds of things. What's their benefits? Or
so the shampoos, a lot of them tout that they're DHT blocking, which would be good in theory because you don't want testosterone being converted to DHT in the follicle. However, is that getting down to the follicle when you're using it as a shampoo? I kind of think it's not. I don't have any studies to
prove that up. Right.
Yeah. So I don't know about that. It's not something I would go out and purchase.
You wouldn't invest in that.
I wouldn't invest in that. Not at this point. Maybe in the future, but that remains to be seen, shall we say.
Now, so we're in a system of let's say PRP, and we're going to inject and we're going to microneedle it. One?
No, you need a series, at least 3, 4 to 8 weeks apart, and then probably maintenance every 6 months to every 12 months. And that's going to vary from person to person. So we don't know because all the studies are all so different. It's all people doing different levels of microneedling and people have different platelet counts. It hasn't been standardized. All we know is that it does help.
Right. One of the things that we did earlier this year was to put a couple actually on the plated, and we had them do 2 bottles of plated and then start with the microneedling and the PRP.
And plated is
the serum
of the exosomes.
The exosome serum. And so we had them do 2 bottles each, and then they started coming in for their injections with their PRP and their microneedling, and they're seeing some really nice results.
And that's the beauty of the hair matrix is we
can actually count it.
Yes, we have a quantitative, not just a qualitative measure. Perfect. The other thing you can do too is the topical minoxidils.
Okay.
So 5% is marketed to men, 2% for women, 2% does diddly squat. Don't even bother with it. Just go straight to the 5%. You got to apply it twice a day, and it's a mess. And come on, I mean, if you're going to work every day, you're not going to be putting goop in your hair, right? Sorry, it's just not practical. So what's become big in this field in the last few years is use of oral minoxidil. So minoxidil was developed, in the 1950s, 60s for high blood pressure. And at doses of 10 to 40 milligrams, it lowers pressure, but oops, it also makes hair grow everywhere. So it kind of got shelved for a while, but it has been slowly brought back, specifically for hair loss. Now, we don't do big enough doses to do anything to your blood pressure. So we're talking 2.5 milligrams is probably my starting for guys, 1.2 for ladies. We could even do 0.625 if needed, if you're sensitive to it. It's going to take 6 months before you see anything, but it will grow hair. And I've had several of our staff members on it complaining about it growing hair, not only on their head, but on their knuckles as well. And if that's the case, we can always laser it.
That's
so
right.
It's not.
We have a solution for that.
Yes, we have a very easy solution for that. So that is a nice thing. You just take a pill once a day. You don't have to muck around with any foam or anything. The other thing are the androgen blockers.
Okay.
So spironolactone is one. And then the finasteride, dutasteride, those are traditionally thought of for prostate enlargement for men, but off-label we can use it to block the androgens in the scalp. they can have some sexual side effects, so they're not my first choice.
Right.
I'd rather go with the spironolactone. We got to be careful. That can lower your blood pressure as well, so we got to watch that.
Yep.
Yeah.
Absolutely. So in men,
Mm-hmm.
specifically, we'll talk about both men and women, but first men. In men, who is a good candidate?
Okay, so that's a great question, because if you're bald, there's nothing there. There's no grass there. No matter how much we fertilize it, it ain't going to grow.
Right.
So that's a way to kind of think of these treatments, is fertilizing the grass. You are giving those follicles everything they need to grow. If they're dead, they're not going to grow. If they're in the process of dying, we could probably
save them
or rejuvenate them. But if they're dead, they're not going anywhere. Or nothing's happening, I should say.
So somebody's been bald for the last decade.
Ain't going to work.
Isn't going to work. Somebody that's starting to recede or get the baloney patch, but it's not completely gone. Those are the people.
The time to do it.
To come in and start there.
Yeah, when you have those wispy hairs that are still there, get in here before they die off, because we can try to rejuvenate them.
Yes. What about women?
What about them?
What women is? What about women?
What about
what women are good candidates for? This is not a problem that is going to plague my life, right? But I know it plagues a lot of people's lives. So, what kind of loss are we looking at for them?
So half of postmenopausal women lose their hair. Okay. Half. And women are 50% of the population.
Yeah.
So a quarter of the population is going to lose their hair. I mean, that's staggering.
That is staggering.
And nobody's really researched it, which is really frustrating. Because we know there's a hormonal component to it, but we don't know exactly how. If you're menopausal and we give you a ton of progesterone, would that help grow your hair like it does in pregnancy? Possibly.
Right.
We don't know. It's not a bad thought, but it's not something I would do just for your hair loss.
Sure.
I'd want you to do it for your bones and your brain and all the other good things that it's good for. But women tend to thin. They tend to not necessarily recede, but they thin, and they get what's called a Christmas tree pattern. Their part widens from the front back.
Yeah.
And this is a scale that we often use, the Ludwig scale, to define it. So you can just start with barely thinning to really completely lost. So you want to catch it somewhere in here.
Yeah.
You don't want to wait till it's here.
Right.
Yeah. If you are receding, then there's a different diagnosis that we got to talk about. Frontal fibrosing alopecia, and that's a whole different ball game. So make sure whoever you go to see, if it's not us, is actually looking at you and looking at your scalp and examining your hair.
So what about somebody that has full-blown just alopecia, like no eyebrows, no eyelashes, no hair? Is this something that could help with any of that?
No, because that's usually an autoimmune issue where your body attacks the hair follicles. And once, like we were saying, once follicles gone, it be gone.
Yeah. Same thing with cancer patients?
Cancer patients, not necessarily.
No?
Cancer patients, it's more like, it can be more like the telogen effluvium, where there's a stress to the body, like pregnancy. So when there's a stress like that, the body isn't going to divert nutrients to hair growth. It's going to divert all its energy to keeping you alive. And what's a bigger stress than cancer and chemotherapy? Pretty darn big. So a lot of times once they're through chemotherapy, they will get some growth back. Sure. But it can accelerate that and accentuate it.
Nice. So how do I get started? So well, not me, but
so come in, we'll do a consultation. We'll do the hair matrix. If you've had previous labs drawn within the last 6 months, bring them in, because a lot of times there'll be a thyroid panel on there that we can look at. So bring all that, anything that you have in. We will examine you. I might send you for more labs, because often the thyroid labs especially are not thorough enough.
Right.
Once again, that can be a whole long discussion. But we will check all that, and we will discuss with you what's going to work best for you and for your lifestyle.
Perfect. And when you're ready to get started, give us a call, 394-3915, or you can find us online, stlouisskin.com, or you can email us at info@stlouisskin.com, and we'll get you all taken care of. Thanks for visiting.
Bye.